7,300, the number of pills taken yearly. 730, the average number of hours spent doing treatments in a year. 14, the average number of hours spent traveling to and from appointments in a year. 13, the average number of hours spent at an appointment in a year. These are the numbers of a healthy person with cystic fibrosis. Cystic fibrosis, sometimes referred to as CF, affects over 70,000 people worldwide, and approximately 1,000 new cases are being diagnosed each year. Cystic fibrosis impacts more than just the person with the disease, it impacts the whole family. On March 13, 2010 at 9 p.m., we were blessed with a baby boy. He was 9 pounds even at birth. Before he was 2 weeks old, I received a phone call from the pediatrician's office. They wanted me to come in to meet with a doctor. When I arrived, I didn't have to wait for very long, and the doctor told me that he had received the results of the newborn screen, and there was a possibility that Joshua had cystic fibrosis. What is cystic fibrosis? That's exactly what I asked the doctor. Meeting with the pediatrician changed our lives forever. Oh, he'll grow out of it. Just use the soil and it will get rid of it. Who in your husband's family has it? Because nobody in ours has it. Will he end up in a wheelchair? He looks normal. These are just a sampling of comments that parents of CF children hear. Most people just have never heard of it, or they have extremely outdated information. I'm here to help you understand what these families go through, how you can help, and what you can say to those affected by this disease. I'm going to share one more number with you, 40. This is a median predicted survival age for someone with cystic fibrosis. So what is cystic fibrosis? Cystic fibrosis is a progressive genetic disease that causes persistent lung infections and limits the ability to breathe over time, according to the Cystic Fibrosis Foundation. It is a genetic disease. Patients inherit one copy of a mutated gene from each parent, so both parents are carriers of a mutated gene. There are over 2,000 different CF gene mutations. Our son was diagnosed through the newborn screen. By 2010, all 50 states were screening for cystic fibrosis as part of their newborn screening. Arizona implemented the testing for cystic fibrosis in October of 2007. The day before he turned 3 weeks old, Joshua had to do a sweat test. The sweat test is the industry standard to confirm a diagnosis of cystic fibrosis. What it does is it measures the amount of sodium chloride excreted through the sweat glands. And once a child is diagnosed, any of their siblings may need to be tested. So in the 1950s, a person with CF wasn't expected to live long enough to attend elementary school. 8 years ago, when our son was diagnosed, the predicted survival age was 37. Now it is 40. So now that you know what it is, we're going to talk about how it affects the family. One study discovered that informal caregivers, like parents of young children with CF, are required to adapt quickly to the caregiving role. They take on more responsibility with this role as young children and infants require assistance with administration of medication and treatment management. I surveyed over 100 patients and caregivers, and 89% of them did not have a family member that had previously been diagnosed. 7% of those surveyed had a previously diagnosed family member, but they didn't realize that they could possibly pass it on to their children. And only 4% knew that they could have a child with this disease. Studies have reported that families of children with chronic conditions need to spend a substantial amount of time to complete recommended therapies at home. There's also a lot of time spent going to and from doctor's appointments. It's not just the travel, it's also the length of the appointments. They can last up to 2 to 5 hours. The frequency, most patients go every 3 months, and the number of people they see. There are several people that they see at each appointment. There's also the time spent on the phone with insurance companies trying to get things covered, like medication and appointments and tests. There's the hospitalizations that sometimes can last up to a month or longer. And And then there's money. Some of the medications are extremely expensive. One of my son's medications for 1 month supply is up to $2,500. Another medication that's really new, let's just say you could buy a house every year with it, with the amount that it costs. There's also the hospital stays, the travel, the food, the lodging, doctor visits, the travel, and the copays add up. Insurance, high premiums, and high deductibles. There are also social implications for the patients of cystic fibrosis that have cystic fibrosis. Sometimes they have to wear a mask, and they may feel embarrassed to do so. They're sometimes absent from school, especially during the cold flu RSV season. They have to have extra salt, so sometimes you'll see them maybe just licking it out of their hands or pouring it from a packet. They have to consider relationships as well. As they get older, they have to make some tough decisions. One article that I found said that this disclosure is significant within the context of romantic partnerships because CF affects reproductive viability in at least two ways. First, people with CF have a gene mutation that can be passed on to their children. Another reason that sharing one's CF status with a romantic partner can be meaningful is because people with CF have a decreased life expectancy of approximately 38 years, which now it's 40 years. So when you meet these people, a parent or someone who has CF, please don't try to compare their situation with yours. We all have our own hard things, and what's hard for you may not be hard for them, and what's hard for them may not be hard for you. Please don't say anything that accuses one parent over the other for the child having CF. Even if the mother did everything right during the pregnancy, it all comes down to genetics. Please don't tell the parent that an essential oil will cure it. There is no cure yet. And while essential oils may help with some of the symptoms, they are not the cure. Trust me, we want a cure. Even the newer drugs on the market don't help all patients. They only help a handful. Please don't try to share articles written by people claiming that they have found a cure unless they are a legitimate source. But we'll probably find out first anyways. Also please don't try to compare one CF child to another. Even if they have the same genes, they may present symptoms differently. And when you're around people with CF or parents of children with CF, please practice good hygiene. Coughing into your elbow, staying home when you're sick, using hand sanitizer, and just simple hand washing is a good way to practice good hygiene. Try to be compassionate. Try to listen and empathize and validate their feelings. Have patience, please. Even if they cancel multiple times when you try to get together with them, they're probably not trying to avoid you. It's just really hard to get a babysitter and to do treatments and to be away from your child, especially when they're young. And kids get sick. Some other support you can offer is you can ask about their child, ask about them. Ask them about cystic fibrosis. They'll be happy to tell you. Some other ways that you can offer support is to maybe volunteer to watch their kids so they can have some time for self-care or a date. Just go sit with them and chat. There are several ways, several foundations that raise money for research for cystic fibrosis. The research is not government funded and it is strictly private donations. So research has come a very long way, but there's still no cure. But now that you know a little bit about it, and next time you meet someone with cystic fibrosis or a parent of someone with cystic fibrosis, you'll understand their urgency and passion when they ask you to help or donate with a fundraiser. You'll understand the strain that it puts on their family. You'll understand how it affects their current and future choices. And you also know what not to say to a parent or a person with CF. You'll be able to offer assistance that will actually be helpful. And most of all, you'll be able to provide support for them and show them compassion.